So, as I told you guys in the opening, we had an incident last night where Patrick the Piranha. Now, I want to use a more descriptive word that is accurate. You know, as a horseman, you say, "Oh, he flipped his heart," but I don't actually know what that means. I know it has something to do with the heart and arrhythmia, and it's an irregular. I think it's an irregular heartbeat. Is that right?
Correct.
Okay, so it's a regular heartbeat, and you see what it can do, right? As you can imagine, it turns a very good horse into a completely useless object in what seems like a blink of an eye. It seemed like he was racing fine, and then all of a sudden he wasn't. And it's hard for me, even me as a trainer, because I've seen it happen as a driver so many times. You know, you say, "Oh, he flipped his heart," but when I try to think about it and actually articulate it properly, I have no idea. So I thought, rather than me trying to explain it in terms that are out of my depth, I was in Ohio, I was in Northfield, and obviously it's Sunday. Dr. Tessa isn't working today. I bribed him with lunch. He's not working today, but I asked him if he would do this video. He said he was. So, start from the top. I guess, what is flipping your heart? What does that mean? How does it happen? How do you mitigate it? Does it happen again? Obviously, every horse is different. I looked through this horse's past. There's no past history of this at all. He certainly never offered to do anything like this with us before. So, soup to nuts, top to bottom, what is it and what do we do?
Okay, like you said earlier, it's an arrhythmia. Flipping the heart, A-fib, atrial fibrillation is the proper term, but we just kind of just call it flipping the heart. Is it common? No. Do we see it in standard racing? Absolutely. I know one study has it about 2.5% prevalence in any equine population that you see horses will A-fib. Typically, it's just A-fib. There's no other underlying cardiac issue going on with the race horses. So a lot of times we look, we worry about, heart murmurs, heart valve issues with that. But with A-fib and flipping the heart, typically it's just straight up A-fib.
It's so weird because it's when you say that, when you see something like this that is so tough to watch, it's pretty gut-wrenching to watch, it's hard to believe that there isn't something significant or something long-lasting or long-term that can come from that. And I guess that's hard because every horse is different. But when you just look at an atypical horse that flipped their heart out of the blue, what does that, what is going on that night? And then how does so
with A-fib, there's the atrium and the ventricles in the heart that pump the valves and move the blood. So with A-fib, there's a disconnect with the electrical stimulation and the contraction of the atria that pumps the blood. So all these little waves and electrical currents are out of sync, so that part of the heart just kind of doesn't know where it's going. It's all over the road. So everything's out of sync with that, so that's the atria is pumping blood into the ventricles. With it being out of whack, not enough blood or cardiac output or stroke volume is being pumped through the body. It's almost like running an engine with almost no oil. It's not getting through the system. So that's why horses will appear very weak at exercise, and they get wobbly because they just have no power. Now, horses with A-fib at rest, they're fine. You wouldn't know. Standing in a stall, sitting out in a field, like, you would have no idea.
So that's a good point. So my wife had said to me, she took care of him last night, and she said he seemed fine all night. He warmed up good. He was very quiet, which usually he's a little wound. Last night he was very quiet, and then when they went, he was a TCO2 horse. So those of you that may know, they test before the races for TCO2, total bicarbonate, whatever it's called. So they have to take blood from the horse. So you'll see a commission person come up and take blood from the horse. My wife said she walked up to take blood and his nostrils flared. Really weird, like he'd never done that before. And then in post-parade, James said, like, if you watch him before, he's really fiery and up on the bit, and James said he was really just 2 fingers the whole day, the whole night.
Right. So in a case like that, could it be there was a nervous stimulation that caused the valves of the heart just to kind of go out of whack, the electrical currents just...
It's hard to believe. It's hard to believe that would cause that, but at the same token, I was always told that if it's not a normal horse that has heart issues, that almost every time it's an electrolyte imbalance.
Right, absolutely. So we like to go with the electrolyte imbalance because, yeah, it definitely could cause it.
And he's a Lasix horse.
Our electrolytes are important for the channels with cells and contraction of muscles and the atria, big heart in horses. So a proper electrolyte balance will try to keep those in line where it won't trigger an A-fib. So definitely, it's one of our causes we look at to make sure their electrolytes are balanced. Lasix horses, they'll urinate a lot with the Lasix administration, so you worry about them being dehydrated and losing their electrolytes. That's always a reason we look to as vets of what causes AFib. Also with AFib, we can listen to the horse as soon as it gets off the track, and that's where most of us get our diagnosis, and we listen to the heart with the stethoscope, and it's just completely just out of rhythm. Like,
his was. They said they could see it with a
everywhere.
hand. They could feel it with both Dominic and Amy. I spoke to them separately last night. She was on her way home. He was on his way back to the barn with the horse, and both of them said the same thing. He said you could put your hand on the side of him, and it was weird. And he said No Free Lunch raced in the same race, won the race, and Dominic said, just for my own understanding, he said I went and felt his heartbeat, and it was like thump, 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 and Patrick's was like thump, thump, thump,
right,
thump, thump, thump.
Whenever we learn about AFib in vet school and we talk to people about what we hear as vets, it's almost as tennis shoes or tennis balls in a dryer. There's just thumps everywhere.
Yes.
And you don't know where the next beat's coming from.
So, I guess without knowing the horse, because again, I'm putting Dr. Latessa on the spot here because you don't.
Me lunch though. So.
That's true. I didn't promise I was paying. I promised I would take you to lunch.
I mean, I have nothing else to do.
So I am putting him on the spot because he's never seen. It's unfair to ask a doctor to diagnose a horse that he's never seen. But at the same token, I wanted to be able to bring it to you that it's easy for me to say, don't worry, we'll be able to fix this. Now, I guess the most important message of all is, if this was what I would call anomalous, I use the word a lot, especially when it comes to injuries in horses. If this was an anomalous occurrence, one, when you see what happened last night, is there any long-term damage? Two, is it manageable so it will never happen again?
Right. So, absolutely, we need to know that information for what we're doing with these horses. With most AFib horses, they may convert back to normal sinus rhythm on their own. And typically, they're going to do that within the first 48 hours.
Yeah, he did today. He was fine.
So horses that convert back on their own, they'll, a lot of studies will show about a 15 to 20% reoccurrence rate. So, now there's an 80% chance he'll never do it again.
Yeah.
But there's also a 20% chance they can. And what's going to trigger it?
That study, now when you say, so I think it's also obvious and important, is that as trainers we're learning more about this also. Veterinarians are obviously learning about it too, but when it comes to that 80%, I have to wonder if this is if it is electrolytes and it is manageable.
Right.
I mean, does that change the 80%? Because I have to wonder, if you say, hey, we studied 100 horses that went into AFib and 15 to 20 of them did again. Were those horses treated with electrolytes properly? Yeah. Did you stay on top of it? I mean, we obviously, for some horses that tie up, like a Glariam is one of our horses, and we will draw blood on her the day before she races. Sometimes the day she races to make sure she's not tied up. Yeah. Now, watching electrolytes can be done in the same manner, I would imagine, right? You want to keep your levels in a certain area, and when you see them start to get low, you can address that. And the difference between muscle tie-up and cramping, obviously, and electrolytes is you can change that electrolyte load, that electrolyte level in a horse quite quickly, where you can't with muscle. So if we manage it, my take on it was, if we manage to stay on top of it, this should be a problem that we shouldn't see again. In fact, I would go as far as to say, is if we do see it again, that's on us, not on the horse.
Yeah, I mean, I think that's safe to say. I mean, you're going to want to do everything possible to make sure the horses are hydrated, the electrolyte balances are where they need to be.
I think I know the culprit. I think we trained him in the middle of the week on Lasix, so he had Lasix last Saturday. He would have had it again on Wednesday, and then again on Saturday. We got to get rid of that Wednesday. Now,
some horses, that protocol is perfectly fine, and it's, like I said, there's a
I notice it's the hyper ones. It's the ones that are wound really tight.
Right.
The ones that, as a driver, that I always noticed that were A-fib horses, that were horses that flipped their hearts.
Yeah.
They were the ones that were always wound and wired tight. Yeah. And this guy is. Yeah. He is a ball of nerves and power all the time when you're sitting behind him. So I think maybe that, you know, when you factor in the way the horse is himself, the way that horse is, and then factor in the potential for him to flip his heart, and then factor in the fact that we trained him on Wednesday, where yes, he got Lasix, yes, he urinated a lot, yes, obviously some electrolytes came out, and we would have rehydrated him before the race. But if we can somehow cut out that Wednesday training with Lasix, I think that again, that would play a major role in him not doing anything.
Absolutely. And the fact that this horse did convert back on his own, to me as a vet, that gives me, you know, a better prognosis of, you know, how's he going to be in the future.
Yeah.
Horses that don't convert back in the first 48 hours, you know, what do we do? There's pretty much two options we'll do with horses. You know, one is medical treatment with quinidine.
Yeah.
It's an anti-arrhythmic drug that'll help get that circuit back in line. If that doesn't work, or another option to go is actually electrical conversion that they'll do in humans. They've been doing it in horses. But, you know, typically we have a good success rate with the quinidine, about 90-some%.
Mm-hmm.
We'll convert back. And like you mentioned, you know, whenever we get them converted back, you know, how can we help us get them to stay that way?
Mm-hmm.
And, you know, it's like you mentioned, just maintaining their...
I think stress level must play a role. It does in humans.
Absolutely.
So anytime I talk to anybody about horses, these are living, breathing animals. So you'll usually be able to see a line between how we treat and what goes on with humans, and the same with horses. You have a hyper wound up horse all the time. You know, you're dealing with a horse that fits into that category to begin with. Then you're allowing him by treating him with Lasix in the middle of the week, and maybe not being able to get the electrolytes back in him quick enough or properly enough. It always pushes him right up against that line. So I think knowing that this horse can, you know, flip his heart, in and in itself, retooling the way you train him should be able to manage that without anything else.
Yeah. And I think with this horse, like you mentioned, his routine was different that night, where they pulled his blood to test.
Yeah. And I find it hard to believe, though. You truly believe that could...
A nervous horse. I mean, I know we could just assume things, but that's not his typical routine when he goes to race.
That's true.
And horses know their typical routine.
Yeah.
And if something changes, it may trigger an extra surge of nerves that could have had those electrical currents go out of whack. Who knows? But, you know, definitely his routine that day was different due to that.
Well, that's true. So. Either way, I wanted to make sure that everybody understood. Listen, we all have, as a group, the entire stable.ca cheers for all of our horses, and certainly cheers for Patrick the Piranha. Everybody out there, if you're an owner, you know exactly how much we paid for him. If you're a fan or a follower, you know what it took to bring Patrick the Piranha to the stable.ca. So there's that added level of stress for me, and that added concern also. It's not that I wouldn't concern if a lesser horse did it, but when one of our flagship horses, you know, 3 Point Blue Chip broke his foot, and you and I talked about it, and I told you they inserted the screw, and I didn't know they could do that. You know, this is 2 weeks in a row now we've had a problem with two of our, as I said, flagship horses. So I wanted to make sure I brought everybody the information on 3 Point Blue Chip. The surgery went well. The prognosis is very, very good, which is awesome. Patrick the Piranha gets injured also in a way that is gruesome. You know, you watch him finish the race, you're like, oh my God, you know, the horse is, what happened? And I guess to see a horse race the way he raced last night, finish the way he finished last night, this would almost be best case scenario. He didn't bleed in a way that is detrimental. He didn't tie up, which would be concerning to me. He didn't break a bone. You know, you have a horse that did flip his heart, but after talking to you and talking to a number of the other veterinarians that we use in Ontario, this was more than likely an isolated instance that can be absolutely managed with just a simple tweaking of his training program. So for those of you out there that are very, very concerned with all things that could lead to the race that we saw last night, this likely was the best case scenario. The prognosis is excellent. I assume I'm using that wrong?
Yeah, so as long as they're in normal sinus rhythm, they have an excellent prognosis to return to racing.
So, excellent prognosis for the horse. The fact that he never did it before leads me to believe that this was an anomaly, and that we can manage it and treat it, and he will be back to 100% in no time at all. So with that, as I said, I appreciate, thank you very much, Dr. Latessa, for coming and doing the video. We're going to go eat now, and I hope everybody feels a little bit better about what went on this Saturday night. Take care.